Hi, everybody. Welcome to today's session, which is about capturing impact from public involvement. We will be hearing about experiences and work that Adele, Noreen, and Carmel will be sharing about how they capture the impact of public involvement. I'll just start by giving a few slides. My name is Mirat Kaur. I'm part of the National Institute of Health and Care Research, and this has been a series that we have carried out, and we're going to provide a summary of the whole series as well shortly. But this is a series that we've carried out about impact, just to kind of really highlight what is going on, what people do, to give people ideas. So just a bit of housekeeping before we go any further. This session will be recorded, and that will be shared on the YouTube. Because this is set up as a webinar, we can see the presenters today, but we can't actually see participants. So your faces won't be on the recording. If you don't want to be any part of this, if you're putting a question and answer in, which you can do using the question and answer function, feel free not to use your name if you don't want your name highlighted. But generally, the link will be shared. We do also have tech support today from the fabulous Nikki. If you have any questions or issues regarding tech, feel free to put a chat message in, and we can see how we can help you as well. So today's session, just going to give you a very short introduction to evaluation learning and public partnerships, why we do this series and what it's all about. And then I'll hand over to Carmel, Adele, and Noreen, who will highlight some approaches that they've taken and used in their various settings. And then we'll have a short question and answer session. So again, at any stage, just use your question and answer function and just put a question in there, and then we can present that back to the presenters today. So this session is part of some broader work that goes on to advance the evaluation and learning of public partnerships. And the idea is that public partnerships are great. We're getting to the stage where we're actually doing it quite widely. They're happening quite regularly. And by public partnerships, I mean when researchers, healthcare professionals, patients, public communities all work together, basically, in various ways. And the term we use here is public partnerships, but I don't really mind what you call it. This is just the term we've used today. But they are happening quite well. We've got a lot more partnerships happening at lots of different types, and lots of different ways people are shaping health and care research. But there's continue to be questions about actually, how do we improve what we do? How do we improve these partnerships, what they achieve, and how effectively we work together? So this series aims to continue conversations around that and really highlight what people are doing, how people capture the learning and improve how they're working together. And the idea, crucially, is to share and encourage the implementation of existing approaches that you can take to capture impact. So what is impact? It is a hugely nebulous term. We know this. So in response to that, there was an NIHR patient and public involvement impact working group. And they defined impact as the changes, benefits, and learning gained from the insights and experiences of patients, carers, and the public when working in partnership with researchers and others. And the reason we share this definition is because it exists, because actually, initially, a few years ago, we were asked to define impact, and then people from the impact working group were saying, no, we've already done that before, so let's not focus on defining it, because this is a good enough definition. Let's move on to actually how we do this. How do we capture the impact? How do we capture the changes, benefits, and learning from these partnerships? So this all builds on work from a review of public involvement in health and care research, which was called Going the Extra Mile. And this review, which was carried out a little while ago now, but it said that we need to ensure that public involvement and public partnerships generally, but public involvement adds value and leads to better health outcomes and isn't just an end in itself. And I think even though the review was carried out a while ago, I think this is still very much relevant. We all want to ensure that actually what we do has impact, adds value. We don't want to just go and sit there for no reason. And this is true of regardless of why you get involved in health and care research and what position you tend to take and what role you tend to take. So as part of our work to implement going the extra mile and really improve things based on the recommendations in that review, we had evolved 5 areas of work. And as you can see, impact and learning is one of those key areas because we understand that this is really challenging. It's one of those things that people have really struggled with over time. But also conversely, there's also really great examples of how to do this in practice as well. A few years ago, we had a couple of sessions with the public on what are our priorities for all these 5 areas, and specifically for impact and learning, what are the priorities? And so people said, actually, the priority is to define impact. And so we obviously are resharing the NIHR definition of impact in response to that. But the second one, and the reason we have this series of sessions is for the second one, where people are saying we want people to collate and share examples of how this is done across the NIHR and beyond. So these sessions really aim to respond to that and share with people ideas of how this is done in practice. So today's session is really about figuring out the program theory, the theory of change, or logic models, or all these different phrases of public partnerships. And it doesn't matter what term you use. I don't think anyone here is particularly a stickler on what term you use. But these terms all exist, and these approaches all exist because public partnerships is really hard. It's done in often really hard context and it's really complex. And by that, we mean that healthcare in itself, the context that we work in, is complex. And I'm not going to go into this too much, but it's a really complex context with lots of different parts and lots of different people and lots of things happening at any one time beyond our control. And so in terms of why public partnerships is complex, there's this Glauberman and Zimmerman definition of what that actually means. So they say that a simple problem is like baking a cake. You follow a recipe, and if you follow it right and you use the right ingredients, you'll get a cake. And then they say a complicated problem is sending somebody to the moon. You have lots of different teams working on lots of different parts, but generally they'll come together and get that rocket to the moon. But then you have a complex problem, which they say an example of that is raising a child. You may have multiple children in exactly the same context, being raised by the same parents in the same environment, but actually each child may turn out to be incredibly different. And it's really hard to control what the outcome is. And that's what a complex problem is. And that's essentially like public partnerships. We have lots of different people working in lots of different ways with different understanding, bringing different skills and experiences. And then that means how people work together is often changing or it varies, and we don't often know why. But also what can happen is people come together and they themselves may have different understandings of what we're trying to do, why we're doing it, and how we're going to do it. And unless we air this and really understand what people's understandings are, it's hard to figure out what we are aiming to do, how we're going to do it. And often the difference in what people think isn't realized until the end, when people say, actually, but I thought we were meant to do that and we didn't do that. And then somebody else is like, oh, were we never going to improve this bit? I thought we were meant to do that. So the idea of today's session is really to share with you some approaches to understand the why and the how. So why are we doing what we're doing? How will we do this? And essentially connecting these up and figuring out how to do that. So before I hand over to the speakers, which I will do in a minute, Just want to thank Nikki Bent for the event management support today. They're the reason that you are all here and this is running smoothly, and everything always tends to with Nikki. I also haven't put on here, but I want to thank Kasia as well for the communication support. Again, the reason you're here and the reason you saw all the events and the advertisement was because of Kasia. But also this session builds on, and so just want to acknowledge the previous work of the Patient and Public Involvement Impact Working Group, and obviously today's speakers, who I'm going to hand over to now. So I'm going to stop sharing, and I'll be handing over to Carmel first, and then we'll hear from Adele and Noreen as well.
Wonderful. Thank you, Mira, and good afternoon, everyone. My name is Dr. Carmel McGrath, and I'm a research fellow, so I work across the NIHR Health Protection Research Unit in Behavioural Science and Evaluation and the NIHR Applied Research Collaboration West. And I'm really excited to be here and talking to you today about the application of logic models to public involvement, so for planning and evaluating public involvement. And this is something that I explored as part of my PhD. So just to give you some background, so my PhD research was all about how we can work with public contributors in order to create that longer term impact on the research. So as you progress through the research process, what happens at the end? And as part of this, I was exploring using logic models as a framework to be able to capture that impact. But before I go into talking about logic models, I just wanted to share with you some of the insights that I gained around public involvement and impact through my research. So firstly, just to say there were different reasons why people felt it was or was not important to be evidencing the impact of public involvement. So some argued that actually we shouldn't be evidencing public involvement impact to be justifying why we should be doing it. Actually, what we should be focusing on is doing evaluations to see where we could improve our practice and optimise our way of working with public contributors. But for the public contributors, actually, they felt it was really important to know what difference they were making to the research. You know, they're giving their time and energy to support, they're sharing their, you know, sometimes quite raw experiences. So actually, they wanted to see what difference it was making. And then others felt it was important to be like creating measurements of impact and generating that robust evidence to justify the funding and the resources that goes into public involvement and to make the case for further funding. So in addition to the various perspectives on whether or not to capture impact, there were also different types of impact that exist. So you might be able to relate to some of these through the work that you've been doing or are doing. So for example, there were impacts for the people involved. So the public contributors reported that they'd felt they'd learned a lot more about their own health conditions and how to manage them because they were involved in research that was related to their health condition. Researchers felt they had a much better grasp and understanding of their subject area because they were being able to speak to people and learn from people who are living with the health condition. And it also gave them the confidence that actually their research was going to have a benefit for the people who are going to be affected by it. There were also impacts on the research itself, so improving participant information materials, shaping approaches to recruitment, being able to develop new and innovative ways to disseminate research findings. And then there were also impacts for the wider community. So there was an improved awareness and knowledge of different health conditions and how to access service and treatments. And this was due to having presentations that are actually delivered by community members themselves. So I think the last two slides just highlight the diverse nature of public involvement and impact. And I think that it really further supports the definition that Mirat's just mentioned, the NIHR definition of public involvement impact, which, you know, highlights the importance of impact being the changes, benefits and learning that come from public involvement. So I think it's worth bearing this in mind when you're planning your plans for evaluating public involvement. But just to summarise some of the main conclusions around how we can work with public contributors to create that longer term impact. So my research showed that what was really, really important was about investing time to build relationships with public contributors from that very early stage. And this was really essential because it meant there were opportunities for public contributors to influence the research and its aims from the very start. Therefore, they had that shared sense of ownership over what the research was aiming to achieve. And it also meant that they could shape how and when they wanted to get involved throughout that process. Therefore, they were more motivated to continue being involved as the research developed. And it was evident that public involvement was considered to increase the relevance and acceptability of research outcomes, but it was apparent that there wasn't a framework that would be able to kind of capture that impact. So at an early stage of my PhD, I received training on the theory of change and logic modelling from Dr. Sarah Thomas and Dr. Kay Larkin. And I'm aware that there are lots of different versions of theory of change and logic modelling out there. So just to say that the frameworks that I've drawn on are from the training I've received, and they've been adapted from the W.K. Kellogg Foundation Logic Modelling Toolkit. So if you would like to access the toolkit, I've included a link to that in the later slides. But I was also fortunate enough to receive an NIHR short-term placement award for research collaboration during my PhD, and I worked in collaboration with the NIHR Imperial College London Biomedical Research Centre and the Patient Experience Research Centre to develop this idea with the public contributors there and the team there, as well as the public contributors at the NIHR Southampton Biomedical Research Centre. So what is the theory of change? So the theory of change is exactly what it says in the name. So it's the theory and the bigger picture thinking behind what you're doing and why you think it will achieve the change. So this can be a really helpful framework for engaging all of your key stakeholders in these really early discussions from the very start, where you can talk about the project, its aims, and going back to the earlier slides where there's clearly a range of impacts that, you know, might be important for different people. It's a great opportunity to really understand, you know, for your project, what will be important for you to capture as impact. And I think as part of that, it's about getting to know the people you're working with. So although you may be working with public contributors because they've got a specific health condition that might be related to your research, they actually, you know, will come with a lot of different experiences and knowledge and, you know, their own kind of reasons for wanting to get involved. So it's just so important that, you know, there is a space to have those discussions. And I think this framework is a really good way of kind of encouraging that conversation. But also as part of this thinking, you're encouraged to be more explicit about assumptions you might be bringing about the work you're doing and why you think that's important, as well as recognizing things that actually may prevent your work from being, you know, effective or being able to be done in the real world and in practice. So obviously, you have your research idea and then something magic happens, doesn't it? And then you produce your research at the end. But no, that isn't what happens. There's a lot of steps along the way that you need to complete before you get to the end result of your research. So the logic model is essentially the framework where you can house your ideas and your discussions around what you want to achieve, but it outlines that step-by-step process of how you can get from A to B. But it also provides a useful frame of reference. So when you are, you know, moving through your research and at the end and looking back at your hypothesis and you're thinking around, you know, your reasons why you think your work is going to achieve the change it will, this is a really useful way to be able to kind of reflect back on that. So in the next slide, I'm going to show you a logic model that we developed as part of this initiative called the Health Research Ambassador Initiative. So this was an NIHR-funded pilot initiative, and the kind of underpinning rationale and aim of that initiative was to develop meaningful and sustainable ways of engaging with underserved communities in order to understand key priorities in an effort to begin to tackle these health inequalities that we know exist. So this slide kind of illustrates that bigger picture thinking around developing that initiative. So looking at what you're trying to achieve, we wanted to develop ways of working with underserved communities and understanding key priorities. The problem we are trying to address is that underserved communities are not often involved in research, but do experience the highest health inequalities. We wanted to develop a program that would create opportunities for individuals from underserved communities to undertake a leadership role and influence decision-making in health research. But to do that, we would need funding, some capacity, staff capacity, training, venues, time, expertise, and not just expertise of, the team delivering the training, but also understanding the expertise of the health ambassadors and where the gaps were in their knowledge of what we needed to do in terms of making sure the training was adapted to meet their needs. So this logic model that I'm going to show you is just focusing on that activity around developing the training. So here we've got our why statement. Why are we doing this work? Why is it so important? So we know there's lower inclusion health research from social groups. They often carry the highest health burden which is not matched by the volume of research. There's also important differences in how different social groups respond to engage with interventions. Therefore, it's absolutely crucial that we develop these ways of working with underserved communities. So how are we going to do that? We're going to make sure that we've got time, we've got expertise, we've got training. Any training that we've got that we can adapt and develop, we'll bring that in. Our activity will be around making sure we can shape the training to meet the ambassadors' needs. And because we've done that, what we'd like it to achieve is to have bespoke training that meets the health ambassadors' needs. As a result of that, we hope that the ambassadors would have new knowledge and skills, public involvement in research. We'd also obtain some feedback on how our training could be improved for the future. And because of that, hopefully the ambassadors would gain some new knowledge and skills that would be useful for them, address the gaps, and something they could use in future research projects or project they're doing outside of research. But also we'd be able to develop a legacy of training that could be used in other community involvement initiatives. So what you can also do with this framework is outline your plans for how you're going to capture the information to support your outputs and your outcomes. So for the specific purpose of this training, our indicators were kind of the number of training workshops that we were going to develop. We used a combination of Microsoft Forms. We had someone doing an evaluation, an external evaluation, and interviewed the health ambassadors to understand if they did acquire new knowledge and new skills, and to pick up on any feedback that could influence future workshops. We also used a CUBE evaluation framework. So if you haven't heard about that before, the CUBE evaluation framework was developed by Associate Professor Andy Gibson. And this is another useful evaluation approach that can be used for understanding the conditions necessary for effective knowledge exchange. So in this case, it was between the ambassadors and the kind of community members they were working with. But this is so you can ensure that you create opportunities for meaningful public involvement. So Andy Gibson has done one of these seminar series. So if you're interested in finding more about that, please do take a look at the recording. So I'm just going to touch on some reflections that have come from actually doing this in practice. So it was I think at the start, when you're thinking about an idea, sometimes it can be quite nebulous. So this was a really helpful framework for us to just frame our thought processes. And as I said, and I think this is a really, really important point, is that it brought in, shared discussion at the start, and we were able to kind of have more of an in-depth discussion and thought around what we were doing and why we were doing it. When I was developing this approach with public contributors, they reported that they really liked how straightforward this approach was, and the words within it weren't complex, weren't difficult to understand, but also they really liked the versatility of the framework, in that it could encompass the range of impacts and outcomes that were important to the different people involved. So just those that I kind of touched on at the start of this presentation. It was a useful tool for being able to report back to our funders. So we included a logic model in our application to the NIHR for this project, but then we also included the updated logic model once we'd done our evaluation at the end. I would say this could be quite a time-intensive piece of work, especially at the start where you're doing all the planning around it. But I would say that it does pay off to do that, because, as I said earlier, it provides that really useful frame of reference for you to go back to as you progress throughout your project and then at the end. Just looking back on how we use this for the Health Ambassador Initiative, it would have been useful for us to have meetings specifically for the purpose of going through this logic model and updating it. So if I was to do this in the future, I would put in meetings throughout the project to just keep revisiting the framework. So just to summarise, the logic model framework can be useful for planning and evaluating and helping to report public involvement. It provides that clear step-by-step process of how you get from A to B. It does encourage that joint decision-making about your shared goals and priorities with public contributors and the people you're working with right from the start, but it can take time and resources to complete. So I'm going to stop there, and I'm now going to hand over to Dr. Noreen Hopewell-Kelly, who's going to talk to us about impact logs. Thank you, Noreen.
Thanks, Carmel. Yes, I'm Noreen Hopewell-Kelly. I am a research associate at Cardiff University at the Curie Palliative Care Research Centre. Previously, though, I was a public involvement lead at Bristol Biomedical Research Centre and the Health Protection Research Unit. And during that time, I worked with my colleagues on developing the public involvement impact log. So I'm going to present today with Adele, who's one of our public contributors. So I'm just going to hand over to Adele to introduce herself.
Thank you, Noreen, and hello, everyone. My name's Adele, and I've been involved in patient and public involvement since 2013. My career was in schools, but I came into this as a carer and after working voluntarily for my local hospital trust. Over the years, I've gained experience in a lot of areas such as genomics, end-of-life care, emergency care and dementia. And I've worked for different organisations and different research projects in an increasing variety of roles. One of these was as a member of a National Institute for Health Research funding panel for 5 years. Back to you, Noreen.
Thanks, Adele. Okay, Carmel, can we have the next slide, please? Okay, so today I'm talking to you, as I said, about the public involvement log. It was developed collaboratively with colleagues in the People in Health West of England, and it started from a systematic review that we conducted right back in 2017. From the systematic review, we were looking at what frameworks were out there that were already available, and what became clear was that there were frameworks out there, but they weren't being used. Now, we kind of thought about why that might be, whether it was capacity. Some of them were very time intensive, inclination. But we took our findings to the International Perspectives on Evaluation of PPI in Research in 2018. And that started off a lot of discussions around what would be a very user-friendly way of capturing impact. And from those discussions, we then invited public contributors to join us with the rest of the team to develop the first iteration of the impact log. And as I said, it was the first of many iterations that have been developed over the years on the back of discussions and feedback. Can I have the next slide, please? Go back one. Gone. That's it. Thanks. Okay, so what does the log do? It's a means to record and monitor involvement process, and it is a way of looking at immediate outcomes that we need those outcomes for reporting purposes to funders and so on. It outlines the reflective process required to understand impact, and it identifies gaps for learning. What it also does is it provides a space for the voice of public contributors, and it became very clear that public contributors quite often wouldn't know the impact of their work. They weren't getting the feedback, but they also didn't have a space where they could discuss their impact, how they felt that they were having an impact on the work, and their voice wasn't being heard in that way. So what the impact log does is it creates a space where conversation is enabled and shared learning can take place by having the voice of the researcher and the public contributor together. And that then gives us a space where, as Carmel and Mira have touched upon, where the why, how and the where can be discussed more openly. What it also does is it provides a good starting point. It's not the most comprehensive of approaches to capturing impact, but it's a starting point, where people are pushed for time, they don't have the capacity. This is a good place to start. Next slide, please. Okay, so this is what the log looks like. As I said, it's very simple. And this is a template, and it's a fluid template. And we do urge researchers to ensure that when they're using it, that it is fit for purpose, and that these columns can be renamed. They can be adapted to the needs of the researcher. What was interesting in developing the log were the columns of outcome and impact, where there was confusion around how those terms were being used as working terms. And although we did make efforts to define them as we were seeing them at that point, what we have tried to convey to people using it is that this is actually a really important part of those initial discussions that researchers have with their public contributors around how is that outcome going to be understood, how is that impact understood, and that can be the basis of the template. So we delivered this in workshops that we were given to various different colleagues at the BRC and the HPRU who were trialing it and piloting it. And we wanted to be able to circulate it without in isolation from the workshop, so that people could independently pick up the template and start using it. With the next slide, Carmel. Thank you. So we developed a very simple text to go with it. So just to break down the columns and just to again highlight the importance of remembering it's a fluid template and it needs to be fit for purpose, but that it is an effective and time efficient way to begin thinking about our impact and reflecting on it. Next slide. Okay, so this is just an example of a completed log. This was used with a piece of work called the Ross study, which was a feasibility study in the Cardiovascular Biomedical Research Centre. And it was quite a long piece of work, which included a lot of public involvement. There were very obvious outcomes as highlighted here, but what I wanted to draw your attention to were the anticipated and the unanticipated impacts that were drawn from those outcomes. And this really highlights the significance of the final column, which is reflecting. So without the reflection of the involvement, the unanticipated outcome wouldn't have been captured. And without the reflection, the gaps for learning and the moving forward and creating the next what and the hows and the whys isn't possible. So I think this really nicely highlights the significance of how very simple recording can have quite an effective impact on our own work. Sorry, Carmel, next slide. Okay, so we then wanted to streamline the log from the paper version to something more, something that was going to be easier to circulate. So I'm going to hand over to Carmel briefly to talk about the online version.
Thanks, Noreen. Yeah, so as Noreen said, we just wanted to provide an option for people to be able to complete the log online, and this was not to replace the paper log, as we know that some people actually prefer the writing, the process of writing down their thoughts. But we've basically produced a Microsoft form with the questions of the log within that, and this means that you can duplicate the form and adapt it for your project. And you can send a link out to the public contributors that you're working with, and what it will mean is that all their responses can be collated into one place. We like the accessibility features as well of the Microsoft form, so you can enlarge the text, and there's read aloud functions. And unfortunately, you have to listen to me, but there is a video tutorial that does explain how you can use the form for your project, and we wanted this to be available for anyone to use. So it is hosted on the NIHR Applied Research Collaboration West website, and we've got some links to this on the slide, so we'll send that out after our presentation today, but do take a look if it's something you're interested in using. So now I'm just going to hand over to Adele, who's going to talk to you about the impact log from a public contributor's perspective. Thanks, Adele.
Thank you, Carmel. By way of introduction, I'm going to give you some context for the impact log that you're going to see. First of all, I completed it when the log format was being trialled, and it was written retrospectively using a journal that I keep. I started the journal as an aide memoir to help when things were sometimes there was a long gap between meetings, to remind me of what we'd actually done, what had taken place, and also to whether I was being effective enough and helping to make a difference, something that public contributors are always worrying about, especially when we're new. It relates to the rollout of a project intervention for atrial fibrillation rather than the initial piece of research, but I have since been able to use the log as part of an actual research project. Could I have the slide of the chart, please, Carmel? So the first 4 columns are what you would expect to see. I'm going to concentrate on the last 3, and you'll see outcome, impact, and reflections or learning. Distinguishing between the first 2 was a bit of a challenge, but I was given a very useful maxim that outcome is short-term and impact is long-term. That was really helpful, and it worked for me. There was fear of an empty box. Initially, this led me to put things in what I later perceived as the wrong box, but the team reassured me that it was okay, for example, to confuse outcomes with impact initially, because we were able to learn from it PPI-wise. What I found was that the impact is not always experienced by or shared with the public contributor. So it's hard to assess without a dialogue between researchers and public contributors, hence the conversations. Then there is learning. 3 of us trialled this, and when we went public, I was concerned that my learning points should just have been about PPI. What you see here is warts and all. Again, I've been helped to see that the learning points were valid on 3 levels. There isn't a right or a wrong. Firstly, on a personal level, there's an example of this you can see on the 5th of November. How effective am I being? What was a challenge for me, and what did we do about it? We had a conversation and addressed that with a positive result. I became more involved at an operational level. Then there's the PPI level. You can see the inevitable acronym problem cropped up, and that was easily addressed by providing me and the other contributors with glossaries to ease our understanding. Could I have the next slide, please? And finally, there is learning at the project or organisational level, which can be a pulse check as the project goes forward. If you look at the box that's going to be highlighted here, it was to do with a survey of patient experience, which we public contributors had designed and was delivered by the GP practices. What we learned was that one of the factors for the poor response was that at the point of GP training, the survey wasn't built into the pathway, as we weren't yet on board. This led to the solution of needing to involve PPI earlier, and that turned out to be a particularly useful learning point, as we were asked to feed into the way forward for the next wave of adoption in the Southwest, and they were able to act on what we had learned. I feel it's also important to point out that there are positive comments in the learning column. Much can be learned from what is felt to be going well. How did I find using the log? It was very user-friendly, it wasn't onerous, it wasn't daunting or scary. It helped to focus and order my thoughts probably more sharply than my journal. There are no negatives or weaknesses for me. The challenge was the outcome versus impact. It needs clear understanding right from induction, especially as the two can sometimes be interpreted differently, I understand, in different settings. There wasn't anything missing for me. Is it useful? Absolutely, but only if it's part of an ongoing and consistent dialogue between researchers and/or the PPI lead and public contributors. You have to make time and budget for that. It informs next steps and learning from experience. After a lifetime in education, there is no point in evaluation if you don't learn from it and the conversation makes it meaningful for everyone concerned. Thank you, and back to you, Noreen.
Thanks, Adele. So, as I said, we've been delivering this for quite some time in various workshops, and uptake has slowly, we've seen increase. I mean, what's been really nice is seeing examples of where the log's been used now being evidenced in papers. And the example here is from a paper that was recently published from some colleagues in the Bristol Biomedical Research Centre who used the log. And it's also being signposted from other organisations as a pragmatic, effective way of capturing impact. Next slide, please. So to summarise, the log enables a tool for reporting, reflecting and learning. It's designed to include the views of researchers and public contributors, so it's the basis of conversation. It's time efficient, and it can be developed to meet study needs. It can be flexible and to make it user-friendly. It's available as a Word template or an online tool, and as I've previously said, it's a really simple place to start. Next slide, please. So I just wanted to echo something that McGrath said at the beginning of this seminar around there are multiple approaches available to capture an impact, and we've given a couple today, but there are many other, and it's about researchers choosing what works for them and what works for the time they have and the research that they're conducting. So my colleagues at Curie have also developed PIRIT, so Alicia Newman and Professor Anne-Marie Nelson, and it's another approach that I just thought was worthy of highlighting. Alicia did present this earlier on in the webinar series, so there is a recording available if you wanted to look into it further. But yeah, I just think it's important to highlight that we're just presenting a few of a much larger number of options available. Next slide, please. Okay, so I'm going to hand back to Carmel now, who's just going to wrap up. Thanks.
Thanks, Noreen. So as we've mentioned, we've included some links to these different tools and frameworks. So we will make sure that you get these after the talk today, but please do take a look at those. And we just wanted to say some acknowledgements, because as you can imagine, a lot of people have been involved in this work that we've been doing. So firstly, we just wanted to thank McGrath, Kasia and Nikki for giving us the opportunity to speak to you today. It's been a pleasure to be here. We also, well, I wanted to thank Dr. Sarah Thomas and Dr. Kay Larkin for their training around logic model and theory of change. And Sarah Thomas helped me all the way through my PhD and then right up to this presentation today. So huge thank you to her. I want to thank my supervisory team. So that's Dr. Caroline Barker, Dr. Claire Ballinger, and Professor Mary Barker for all their support during my PhD. To all our funders of the NIHR, and all the public contributors at the NIHR Southampton Biomedical Research Centre and NIHR Imperial College London Biomedical Research Centre and Patient Experience Research Centre. And in terms of developing the involvement log, we'd just like to say a huge thank you to everyone who was involved in developing that, including the public contributors and the staff and the people in the Health West of England. So I'm going to stop there and hand back to you, Murat, for questions. But thank you everyone so much for listening.
Thank you all. Do you all want to turn your cameras on so we can do the Q&A? And just while you're doing that, just a couple of apologies. On the housekeeping side, I didn't have a no jargon thing, and I realise we all slip into little jargony bits. So there are some acronyms which have slipped out. Apologies, we're just so institutionalised. And yeah, we will try and tackle that in the future. So yeah, we have some questions coming in. Let me just go to them first. I have gone for the ones which people have liked, and I'll go through them in order. So basically, the first question is, how well do public contributors respond to working on these models? Were people happy to spend time doing that at the start, or were they more interested in getting started with the PPI activities? Also, sorry, just to say thank you to Carmel in particular, because she is suffering today. So Carmel, I realise you are trying not to talk as much, but yeah, if anybody wants to take that.
Shall I go first? So with regards to the with the model, the logic model, because it's so quick, people have been really interested and quite happy to complete it where we've used it. And I think that the public contributors that I've worked with in using it they've been pleased that there's actually been a space put aside right at the beginning so that they know their voice is going to be heard, and that's going to be revisited throughout their involvement. So yeah, I've never had a public contributor voice an opinion that they don't want to do it. But again, if they didn't, it's a conversation, and it's very time efficient.
Adele, do you want to say anything as the public contributor on here?
I thought you might ask me.
Sorry.
Yeah, I've worked on a couple of other models, and this one particularly I find so easy. And I think most contributors would welcome guidance at the start. So because there's an awful lot of insecurity as you start, especially if you haven't done it before. So to have a clear idea of what the expectations, the framework is that you're going to be using is just really helpful, and it gives people confidence rather than insecurities. And if you've got that really open conversation going on all the time, then it's got a better chance of working.
Great, thank you.
I think, sorry, just to come in there as well, I think definitely from what I've heard from public contributors, actually there's frustration when they don't know why they've been asked to be involved or how they can be involved. And there's sometimes, there can be activities where actually they think, that's probably not something that would be best use of my time or something I'd really be interested in doing. So I think just even having that conversation already means that you create that space for a more kind of meaningful way of working. And on a practical note, like I say, using these tools could be done within kind of the meeting space that you have created with your public contributors, if that makes sense. So yeah.
Great, thank you. Can I just say, so there seems to be an importance of having the ongoing conversations, and then also the collaborative approach that you are using to capture impact and understand what that could look like, which essentially models the partnerships that we tend to establish. And in all the approaches that we've shared today, regardless of whether we've talked about them in depth or not, but that is quite, those two things are quite key. How influential do you think those are in terms of what you get, but also how you work together as well? Anyone?
I think they're crucial to how well you work together, and I think it shows it demonstrates to public contributors the commitment of the researchers, that they are actually taking that partnership seriously. We've come from historically a place where public involvement was seen to be a little bit tokenistic in some areas, and we've worked really hard to develop meaningful public involvement. And I think that actually having means of this being very obviously collaborative and a partnership is really important. And for me, having a tool at the beginning of your relationship, your working relationship, to demonstrate that commitment to what's happening, what's going to happen throughout your public involvement work, is really important to that relationship.
I'm just looking at the number of questions. So just to say, we will probably, if we don't get to all your questions, we will respond to them and then share them afterwards as well. So there's a question here saying that the approach, they think, focuses on what has changed as a result of public involvement. So sometimes there is no change as a result of public involvement, but the input of the public was still valuable, and that it informed the approach, for example. Would the approach capture this as well?
Absolutely. And I think that actually the unanticipated outcomes is tried to kind of it alludes to that it's actually, it's not those concrete impact measures that we might be looking for traditionally. So yeah, it might not have. The group may not have changed a public information, a participant information sheet, or the way that a study was being run, but actually the fact that they've maybe confirmed that it's a good way. They've identified that it works. That would be captured in a reflection. That is an outcome, and that's why it's so important to have the public contributors' voice as a part of this tool, because they would have identified the work that they've done, and with that conversation between the public contributor and the researcher, together you would be able to identify the impact of that. It's not always an evident, tangible output, and that's absolutely fine. I don't know if Adele, did you want to add anything to that?
Just to confirm it, because I've been in that sort of situation where what I've done is been able to confirm that I thought what was being proposed was the right way to go, or an effective way to go. But it's still, I'd capture that. I would write that down. But again, that comes from the initial conversations about, sometimes it's not just a case about having a say and changing things. Sometimes it's a case of going forward with it and supporting. But yeah, because it's an easy form it's a flexible type of form to fill in, you can record that sort of a situation, and it's still important.
Yeah, and I would also just just reiterate that again, the change, what you're thinking about in terms of change, because yes, there are tangible changes to the research, but there may also be changes for the person involved. They may feel they have more confidence now getting involved in meetings, or the researchers may have changed their thinking around the work they're doing, or how they're working with public contributors and stuff. So I think, yeah, it's important to kind of remember that as well, that there are really important impacts for the people who are involved.
Thank you. There's a number of questions about the difference between impact and outcomes. I know that this is an ongoing, very confusing thing for people, but also there's a question about how long do you wait to fill out the impact part? Is it something you predict, or how do you do that bit as well?
So I would say, obviously, it's very difficult when you are working on different projects and they have different timeframes and you have to move on and things like that. But I think at least if you use it at the start to help with your planning, you can have that discussion about, okay, we've got a project that's this long, this is what we hope we'll achieve by it. When are we actually going to revisit this impact log, and what kind of information are we going to use to support our claims of what we're achieving? And I think around the question around what is an output, what is an outcome, what is an impact, people will have different understandings of that. But I think what we've tried to emphasize through this is just having a shared understanding amongst the team you're working with of what you would constitute as that, because you can break it down as like short, medium, long term. But again, they may be interwoven, an output might also be considered as kind of an outcome. So I think what is really, really important, and this is why kind of emphasizing using this approach at the start, is to have that shared discussion with the people you're working with about what they mean, and also when you're going to continue do that evaluation and what information you're going to use to support the kind of evidence towards those outcomes and impacts. I don't know if Adele or Noreen had anything they want to add to that.
I have, in that I've been in that sort of a situation, and yes, it was about probably 9 months down the line. So it was a long gap before we were able to judge the long-term effect. And I think that's what I think it still stresses the importance of laying things down at the beginning and keeping regular. We have long gaps between meetings, sometimes 6 months. So if you've got, that you've just got a keeping in touch mechanism of how things are going, because I think the thing that sort of threatens it is the speed with which research teams move and have to move. But between our meetings, the world is spinning rapidly, and we're not party to all the other bits that are going on. So if you've got a regular, just an update, then you've got that opportunity to have the conversation and find out, what is happening next. And then, it's having realistic expectations, but the main thing is to plan for it would be helpful.
Great, thank you. I realise we've got 1 minute to 9. There's a couple of questions about funding, the fact that there isn't often funding to capture the impact. It's added on time, but also remuneration of public contributors. Did that happen? How did that happen?
So to answer really quickly, I think Carmel touched upon this earlier and said about using the time of your sessions with a public contributor. So where you're already having a meeting, to set aside a small amount of time with public contributors to look at the log or whatever evaluation you're doing then. I have worked in some studies where we've managed to get some funding to run separate meetings, but where that's not possible, to use the meetings that are already in existence, or the time that's already in existence, which obviously the public contributors are being paid for.
I will, when we send around the question and answers, just to say, I will send out round the NIHR guidance for remuneration of public contributors and payment of public contributors. And also there is something later on about roles, about how do you clarify roles. So we'll send out some guidance on that as well. Great, thank you. I'm really sorry, it is 1 o'clock and I really don't want to keep anyone here for much longer. So we will answer these questions and share them when we share the slides and the recording. I will share these with the panelists and we can just work up some little answers as well, if that's okay. Thank you all for joining us today. Thank you for the panelists. Thanks to Nikki and Kasia for the support. It's been great. As we said, this is just one of lots of different approaches. Use what works. We're not saying one is the best or the only one. It's just about what works in your context for what you're doing. and that's part of today's session. Thank you, everybody.
Thanks, everyone.